let's begin with what the state governments are doing when it comes to fight against drug abuse. Now, state governments have been advised to prioritize the fight against substance abuse in their strategic work plans for a safe and secure society. And this advice was given at the opening ceremony of a two-day training on drug prevention, treatment and care organized by National Drug Law Enforcement Agency for spouses of state governors in Abuja. In her keynote address at the event, Senator Tinubu, who was a special guest of honor, tasked the states to see the war against the drug menace as a collective effort. The First Lady, who was represented by the wife of Inspector General of Police, Elizabeth Egbetokun, commended Chairman Chief Executive Officer of NDLEA, Brigadier General Muhammad Buba Marwa, retired, and the Nigerian Governor Spouses Forum for the initiative.
Combating drug abuse, you will agree with me, requires a multifaceted approach that encompasses prevention, treatment, and support. There is need, however, for increased investment in prevention programs that target vulnerable groups, including young people, schools and communities, as well as expanded access to treatment, services for those struggling with addiction, while comprehensive public awareness campaigns to educate the people should be sustained.
We must challenge the stigma surrounding addiction and cultivate a culture of empathy and solidarity towards those battling substance use disorders. The role of governors' spouses in combating drug abuse cannot be overstated. Through advocacy, we can ensure access to prevention, treatment and rehabilitation services for those affected by addiction.
The NDLEA hit the reset button and renewed the fight against illicit drugs by floating several measures aimed at bringing about a turnaround of the Nigerian drug situation. One of the flagship initiatives was the war against drug abuse. WADA or WADA.
All right, that's Brigadier General Buba Marwa, retired, speaking there in a two-day conference for training, educating the wives of governors on the fight against drug abuse or substance abuse. It's important that we take this battle head-on, tackling it, and it's good that we're bringing in the wives of governors of the various states, and being mothers, they would know how best perhaps to, strategies to take to addressing these matters, knowing that the age brackets who have found themselves neck deep in the matter of substance abuse are persons they can easily speak with, perhaps the age range of their children, and so they would know how to tailor the message such that it gets across to them.
That's right, and I'm happy with the achievements made so far by the NDLEA. They've been up and doing and trying to ensure that they fight the scourge of drug abuse, which is now predominant among our youth. And this is something that stemmed out from not just bad companies, not just peer pressure, but also the fact that the kind of music that we are exposed to, which we'll definitely talk about the regulation of social media, the regulation of the media generally, which is started from now talking about social media, because some of this music are not meant to be shown on television. But I don't know how those laws are really effective now, because when they watch some of these things, some people take these people as their mentor, and they feel it's just the way to go. And some also believe that they can take this thing, without taking this thing, they can't be inspired. They can't understand. Imagine students who is preparing for examination, saying that I have to be high for me to comprehend what I'm reading, for me to even cram properly what I would like to, cram la pour, we do it back in the day. So it's a good initiative. It's the fact that all of the wife of the governors are now being, is it coerced or introduced?
Brought to the table.
Yeah, to
be part of the conversation. Yeah,
take it head on. and not just, coming together to a round table, having a conversation, but getting on the street. Yesterday, I was at the market. Not that I went to everything is expensive.
You're always at the market.
Yeah, but I didn't actually buy. I just went to buy one or two things.
You see?
Not full stop this time around.
Right.
So, so I saw, a gathering of people, the motor park people, talking about, the economy is this, the economy is bad. On top of it, they are now banning alcohol, they are now banning drugs. And then another person now said, to make the matter worse, they now made Naira Marley head of marijuana.
NDLEA. As an ambassador or something.
NDLEA actually refuted, So I had to I didn't want to say anything, but I felt, well, this is our job.
Educate them.
We don't only have to sit here to educate people, we also have to take it to the street. So I had to educate them. And I said, okay, if you're taking drugs, taking substances, you're smoking substances, you're also drinking alcohol in sachet. We see all our younger generations who are taking this, and it's, has this so and so impact, on their lives. I was able to at least convince them, but some said, at least if we didn't see food, we are supposed to even see something we can take to be high. So the menace is really, really, endemic, and we just
yes, it has really eaten deep into the fabrics of our society, and I believe that charity begins at home. And being wives, they'll be able to speak with women who can take the message home to their husbands, their children, and the message trickles down. So it's very important that these conversations are had at various levels, not just at the home level, but even in schools. You have people talk about these kinds of issues in schools so that we can catch them young and help them understand that there are dangers to you taking these things. It is not healthy for the body as it is. So it is good that this conversation is going on, but then beyond conversations, let's begin to see laws in place to actually bring persons to book, going for those who are making a kill out of all of these issues, because if we are not getting them and they are still seeing Nigeria as that market where they can still be bringing in these drugs and substance abuse, it's still a detriment to the society, then we are just scratching the surface. But I know that the NDLEA has been doing a lot.
Really?
When it comes to making arrests. Yes. They're making arrests. We have seen at some point, we know that one of their members was even attacked in the process of they trying to make an arrest. So we must give kudos to them in their effort, but more can still be done. And everybody's hand has to be on deck as it is right now. They alone cannot handle this. And so it's good that we're seeing wives of governors take up this mantle, if I would say. They didn't pass this mantle to handle these matters. I only hope that this will make as much difference in the coming days.
They know how to gather a lot of people, the CSOs together.
They are closest to the people.
To carry these messages to the grassroots, which is very, very important, because people who don't even they don't watch TV, they hardly listen to radio, but it's just word of mouth. And when they hear, this is something that helps us to get higher. We discussed at the editorial, maybe was it last week, talking about a report of people who go into is it in Senegal or one of these African countries? They go into the cemetery and they destroy the cemetery. They cut the bones, the dried bones of those who are already dead, and they smoke it. They believe that gives them, and you now see a lot of zombies on the streets. To what end? What do you want to gain from it?
To get high. But at the end of the day, when you get high, you will return back to the real state and face reality. And face the reality. That's the truth. You face the reality of things. But then people will tell you, oh, the way things are, the society and all, just to help them get out of certain situations. But for how long? Because at the end of the day, reality is still staring you in the face. The situation that you're trying to avoid is still very much with you. So why not look for how to go about addressing it as against abusing substances that is detrimental to your health at the end of the day? So the message can still go on. We can still continue passing across those messages. It's important that we keep hearing it. It is never too late to hear, and it shouldn't be tiring at the end of the day. We leave the conversation here now. Quickly bring you the news update. Access Holdings PLC has announced the appointment of Ms. Bolaji Agbede as the acting group chief executive officer. This follows the death of its former Group Chief Executive Officer, Dr. Herbert Wigwe. Wigwe died in a helicopter crash alongside his wife, son, and a former chairman of the Nigeria Exchange Group, Abimbola Gubanjo. On Friday, a statement made by the company's board of directors stated that the appointment was subject to the approval of the Central Bank of Nigeria. Nurses and midwives are threatening to shut down Nigeria's health sector in less than 48 hours if the Nursing and Midwifery Council of Nigeria refuses to withdraw the new guidelines for verification of certificates. The nurses want the council to address the shortage of nursing staff in hospitals, salary scale, and nurses' welfare instead of attempting to limit the career opportunities for nurses. Sarah Ayeko has details.
The National Association of Nigerian Nurses and Midwives is having a showdown with the Nursing and Midwifery Council of Nigeria. The confrontation is to call for an immediate reversal and withdrawal of the new circular on certificate verifications. Dressed in their scrubs, the nurses marched around the Yaba area of Lagos just to show their displeasure with the new guidelines. They're sending a 48-hour message to the national body.
You not the one that issued that particular certificate to us? Are you saying the certificate being released to us is a fake? We are saying this with all sense of humility and responsibility. If they dare us, we will dare them. If they push us, we shall push them. We are sending an MCN Lagos State branch to the national body that we are giving them 48 hours to withdraw that particular satanic circular.
As we speak, federal government is not employing nurses. We challenge federal government that when last did they recruit nurses, verification or nurses relocating is not an issue. The issue is underemployment of nurses in Nigeria.
Last week, an earlier complaint had been made about the deactivation of the NMCN verification portal since December 2023. The problem is felt by Nigerian nurses and midwives, home and abroad. The nurses say the deactivation of the portal by the council is an attempt to stop them from pursuing career opportunities abroad.
Looking for a total withdrawal of this circular, no to 6 months period, no to letter of good standing, either from a CEO or from a head of nursing. There will still be loopholes. We do not want that. We do not also want the 2 years post-study. Everybody must be allowed to go willingly. So why would they be bringing such circulars? If you need nurses to work in Nigeria, support them to work under good conditions and watch them stay and work for you.
They're also asking that the verification process should take not more than 48 hours. Other demands include an increase in remuneration and hazard allowance. Sarah Ayeko, TVC News, Lagos.
Now to sports. President Bola Tinubu is set to host the Super Eagles team later today at the Presidential Villa, Abuja. The reception will take place after the team returned to Abuja, Nigeria's capital, early this morning. Super Eagles lost 2-1 to the host Ivory Coast at the finals of the 2023 Africa Nations Cup on Sunday. After the game, President Tinubu saluted the Super Eagles for their tenacious performance in the final of the Nations Cup.